keras ya? Dia nikah kan tapi saya bilang udah sama.
Welcome to the Public Health Center of Cipayung. Welcome to the Public Health Center of Cipayung Subdistrict. During the COVID-19 pandemic, the Public Health Center of Cipayung Subdistrict still provides health service for children with the following procedures. First, visitors must wear a mask. Second, before entering the room, the visitors must pass through disinfectant chamber. Third, the visitors must wash their hands in 6 steps by using soap for 20 seconds with flowing water. Fourth, the visitors must maintain a 1 to 2 meter distance with the other patients. Fifth, security guards will check the visitor's temperature before approaching the registration table. Sixth, the visitors take queue number and register according to health service needed and keep maintaining a distance with the other patients. Our public health center provides 2 categories of service for children. First, service for healthy children under 5 of age, comprising immunization service and Sikumbang service to examine detection, stimulation, and early intervention. Second, service for ill children under 5 of age, comprising integrated management of childhood illness. In the service, patients are divided into 2 categories, namely URI patient and non-URI patient. The first will be directed to Children Polyclinic for cough treatment, while the latter will be proceeded to non-MCI room. To mothers who come for children immunization service, don't forget to perform precautionary measures by wearing a mask and using hand sanitizer. And also, don't forget to bring your pink book. See you and stay healthy.
Distinguished speakers, participants, ladies and gentlemen, a very good afternoon from Jakarta, Indonesia, and I wish each and every one of you are in healthy condition amid the COVID-19 pandemic. Welcome to Knowledge Sharing Program on Maternal and Child Health Handbook 2020 with the topic of sharing the experiences and lessons learned on MCH Handbook implementation in the era of COVID-19 pandemic. Before we start the opening session of the program, I would like to inform some housekeeping topics. First, please kindly rename your Zoom name, become your country, underscore your name. Example, my name is Vimala, so I will rename my name become Indonesia underscore Vimala. Please make sure to pay attention to the chat box as some updates and information from the committee will be available in the chat box. And also this program is also streamed online via YouTube channel of Direktorat Kesehatan Keluarga. YouTube link is available in the chat box. So for the participants, if you do not agree to upload your presentation, please inform Ms. Susi by the end of day 2 session. If you do not inform anything, the presenter shall be deemed to have consented about the YouTube upload. To all participants, please submit your plan of action to Ms. Susi by the end of today's session. Distinguished speakers, participants, ladies and gentlemen, first I would like to congratulate 35 participants from 10 countries: Afghanistan, Cambodia, Kenya, Laos PDR, Myanmar, Tajikistan, Thailand, Timor-Leste, Vietnam, and Indonesia that participate in the program. Knowledge Sharing Program on Maternal and Child Health Handbook 2020 is the collaboration between the Government of Indonesia and Japan International Cooperation Agency, JICA Indonesia, in the framework of South-South and Triangular Cooperation. This program is the 12th program that had been implemented since 2007 and had benefited more than 150 participants from 15 countries. So, ladies and gentlemen, without further ado, let us proceed to the first agenda of the program. May I have the honor to invite Mrs. Nani Purwanti, Head of Bureau for Foreign Technical Cooperation, Ministry of State Secretariat of the Republic of Indonesia, to deliver her welcome remark. To Mrs. Nani Purwanti, please, the time is yours, Ibu.
Honorable Ibu Kirana Pritasari, Director General of Public Health, Ministry of Health. Honorable Ibu Maria Renata Hutagalung, Director of Technical Cooperation, Ministry of Foreign Affairs. Honorable Dr. Erna Mulati, Director of Family Health, Ministry of Health. Honorable Mr. Sunsusita Katoi, Senior Representative JICA Indonesia. Distinguished ladies and gentlemen, good afternoon. Assalamualaikum warahmatullahi wabarakatuh. My peace be upon us. In this special afternoon, I would like to convey my gratitude to Allah, the Almighty God, for His blessing and guidance, which enable us to be present and healthy today. On behalf of the Ministry of State Secretariat of the Republic of Indonesia, I'm delighted to welcome you to SSTC webinar on Knowledge Share Program on Maternal and Child Health Book, sharing the experiences and lessons learned on MCH Handbook implementation in the era of Covid-19 pandemic. Ladies and gentlemen, the government of Indonesia has a strong commitment to implement technical cooperation among developing countries through sharing knowledge, skill, experiences, and best practices based on the vision, a better partnership for prosperity. As we have witnessed in the past few months, the global pandemic of COVID-19 has profound impact on countries across the world. All countries have faced difficulties in combating the spread of virus to make sure that their people are safe, healthy. In this difficult time, I hope we are able to overcome these challenges and come out stronger than ever. This pandemic does not stop our commitment to implement short and triangular cooperation program. In this era of technological advancement, we have determined to implement this program featurely so that we are still be able to share our knowledge and experiences without neglecting the COVID-19 pandemic protocol, which to keep us safe and healthy. Ladies and gentlemen, Ministry of Health continues to create success story of Indonesia's short cooperation, and we noted that since our partnership with the Ministry of Health and JICA in 2007, Indonesia have successfully implemented 12 SSTC program on maternal and child health care and took part in several places across Indonesia with more than 150 alumni from 15 countries. Therefore, it is very valuable experience to participate in this program. Through this program, we have the opportunity to share and discuss the strategies, initiative, and action taken by the government of Indonesia as well as your countries to implement the maternal and child health care handbook during the COVID-19 pandemic. I hope we could learn from each other and come with the strategies that relevant to the need of our community to address the issue of maternal and child health care. Ladies and gentlemen, once again, as a part of coordinator of SSC, the Ministry of State Secretariat is committed to improve the quality of Indonesia South-South and Triangular Cooperation. Therefore, we would closely monitor the execution of the program. So please do not hesitate to give your comment and recommendation about this program. As my concluding remark, I would like to thank all officials involved in the preparation of the program, from the Ministry of State Secretariat, Ministry of Health, Ministry of Foreign Affairs, Ministry of National Development Planning, JICA, for their effort and keen interest to organize this webinar. For participants, I wish you a rewarding program, a lively exchange of ideas, as after this program, we will gain a new perspective and knowledge about the topic. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ibu Nani. Now I would like to invite Mrs. Maria Renata Hutagalu, Director for Technical Cooperation of Ministry of Foreign Affairs of the Republic of Indonesia, to deliver her remark. To Ibu Renata, please, the time is yours, Ibu.
Thank you. Ibu Kirana Pritasari, Director General of Public Health, Ministry of Health. Ibu Nani Purwanti, Head of Bureau of Foreign Technical Cooperation, Ministry of State Secretariat. Ibu Dr. Erna Mulati, Director of Family Health, Ministry of Health. And Mr. Sunsuke Takatoy, Senior Representative, JICA Indonesia. Distinguished participants, ladies and gentlemen. A very good afternoon to all of you in Indonesia, and a very good morning, as well as a good afternoon for all the participants joining this program via online platform from other countries. I would like to take this opportunity to convey my gratitude and appreciation to the Ministry of Health of the Republic of Indonesia, Ministry of State Secretariat of the Republic of Indonesia, and JICA Indonesia for their continued support to strengthen South-South and triangular cooperation, and for inviting us to cooperate for the implementation of this program. On behalf of the Ministry of Foreign Affairs of the Republic of Indonesia, I would also like to welcome you all to today's event on knowledge sharing program on Mother and Child Health Handbook. I am confident that this forum will provide us with the opportunity for a fruitful discussion on how to improve maternal and child health, especially during the COVID-19 pandemic. Distinguished participants, ladies and gentlemen, Indonesia recognizes South-South and triangular cooperation as a means to accelerate the progress to achieve the Sustainable Development Goals. Technical assistance provided by Indonesia through the framework of SSC is always ensured to be in line with the SDGs and the country's National Medium-Term Development Plan. South-South and triangular cooperation has the potential to accelerate improvements in health, education, social welfare, in harnessing knowledge and experience, also in establishing critical partnerships, which is instrumental to fast-tracking the SDGs. South-South and triangular cooperation involves the kind of cooperation that creates jobs, strengthens trade, improves health, infrastructure, transfer of technology, promotes regional integration, and at the end, benefiting all countries involved. At this time of pandemic, multilateral cooperation becomes more important than ever. Collaboration between state actors, international organizations as development partners, as well as other related stakeholders, and our collaboration should be geared towards tackling this pandemic and in enhancing our resilience against the potential of another pandemic in the future. We need to continue to strengthen South-South cooperation as our contribution to the common effort to attain the target of Sustainable Development Goals 2030. As we all know, all United Nations member states have adopted the 2030 Agenda for SDGs, which consists of 17 goals to end poverty, improve health and education, reduce inequality, and spur economic growth. One of those goals includes to ensure healthy lives and promote the well-being for all ages, which is stipulated in Goal 3. If I may note that 3 of the main targets of Goal 3, which is related to maternal and child health, among others, reduce the global maternal mortality ratio. By adopting 2030 SDGs, specifically Goal 3, United Nations commits to accelerating progress in reducing newborn, child, and maternal mortality by ending all such preventable deaths before 2030. Distinguished participants, ladies and gentlemen, Indonesia has a long-standing commitment in improving maternal and child health. As Indonesia's economy flourished, it also provided Indonesia with the privilege to play a greater role and at the same time expected responsibility in South-South cooperation. During the period of 2018 until 2019, Indonesia implemented no fewer than 12 SSC programs in maternal and child health, which involved, as Ibu Nani mentioned, hundreds of participants from over 10 countries. We extend our appreciation to the Ministry of Health, the Ministry of State Secretariat, as well as JICA's efforts to carrying out these SSC programs. The coronavirus disease 2019 pandemic is a serious threat to human health, causing severe disruptions to societies and economies, as well as the safety and well-being of people all over the world. The focus of capacity building in the near future, especially for maternal and child health, should lie on the strengthening of the resilience of people against the pandemic through, if I may share with you these thoughts, technical cooperation or capacity building that involve multi-stakeholders and encourages scaling up of innovative financing to support SSC. This cooperation needs to be directed also and to be encouraged for the strengthening of food security, especially in times of crisis. Future technical cooperation also needs to address health cooperation in a broad sense. And this include programs that involve nutrition, family planning, and population, as well as maternal and child health. Distinguished participants, ladies and gentlemen, through this knowledge sharing program, Indonesia would like to contribute to the international development cooperation in enhancing maternal and child health. To conclude, just as we in Indonesia are willing to share our experiences, we are also eager to learn from your respective countries' experiences. When we pool our experiences and derive practical insights from each other, we will have an immense potential to bring a better life for our people. Thank you.
Remarks. Now, may I have the honor to invite Mr. Sunsuke Takatoy, Senior Representative of JICA Indonesia, to deliver his remarks. To Mr. Takatoy, please, the screen is yours.
To the Honorable Dr. Kirana, Director General of Public Health, Ministry of Health of the Republic of Indonesia. Dr. Erna, Director of Family Health, Ministry of Health. Ms. Nanik, Head of Bureau for Technical Cooperation, Ministry of State Secretariat. And Ms. Maria, Director of Technical Cooperation, Ministry of Foreign Affairs. Representatives from the Indonesian government, distinguished guests, ladies and gentlemen, good morning, good afternoon, and selamat pagi, selamat siang. I feel honored to be here and join with you all the opening of the International Knowledge Sharing Program on MCH Handbook 2020 sharing the experiences and the lesson learned on MCH Handbook implementation in the era of COVID-19 pandemic. On behalf of JICA, I would like to welcome all delegates from Tajikistan, Afghanistan, Kenya, Uganda, Myanmar, Thailand, Laos, Cambodia, Vietnam, Timor-Leste, and Indonesia. Now that we all experience an unprecedented situation with the global COVID-19 pandemic, JICA is concerned about its impact on people who are vulnerable and struggle to access health services, especially the women and children. At the same time, we must remember that this is an uneven pandemic. The countries have been affected and have responded in quite different ways. Thus, I believe this KSP is a great opportunity for us to learn how other countries utilize MCH Handbook to ensure the continuum of care (COC) in the era of COVID-19 pandemic, and to learn how to overcome the barriers and the challenges to provide essential COC in MCH services during COVID-19 pandemic. As all of us already are aware, that Indonesia is one of the first countries in the world that officially introduced MCH Handbook nationwide. Since 2007, we have successfully organized 12 times international training courses for strengthening MCH Handbook implementation, invited 15 countries in Asia, Middle East, and Africa. The goal of this activity is to exchange knowledge and experience across different countries, which in the future will improve the quality of maternal and child services, especially during the challenging situation of COVID-19 pandemic across the world. This remarkable 13 years collaboration will continue with the ongoing project of MCH started in October 2018. The project for enhancing the quality of maternal and child health program and the implementation of MCH Handbook in the era of decentralization. The project purpose is to strengthen the capacity of Center of Excellence for Maternal and Child Health Handbook through promotion of the effective use of MCH Handbook for the continuum quality of MCH care services in Indonesia and in other countries. JICA is committed to continuously support maternal and child health service under the project and through this event. Government of Indonesia recently finished the revision process of the MCH Handbook after several steps engaging with the various stakeholders and professional organizations. We do believe that this collaboration and experience to be shared at this event will contribute to have bigger impact and outcome for all the participants. Let me express my sincere gratitude and appreciation to Government of Indonesia, JICA overseas offices in respective countries, and committee members for efforts and cooperation given towards this event. Once again, I would like to say to welcome all of you to the first online knowledge sharing program based in Indonesia. JICA truly hopes that the knowledge and lesson learned from this knowledge sharing program will be utilized where and when needed based on the local situation. Thank you very much indeed for your kind attention. Terima kasih banyak.
Thank you, Mr. Takatoy. Now, to officially open the program, I have the honor to invite Mrs. Kirana Pritasari, the Director General for Public Health, Ministry of Health of the Republic of Indonesia, to deliver her remark and officially open the program. To Ibu Kirana, please, the screen is yours, Ibu.
Representatives of Ministry of State Secretary, representatives of Ministry of Foreign Affairs, senior representative JICA Indonesia, distinguished delegates from Afghanistan, Cambodia, Kenya, Laos PDR, Myanmar, Tajikistan, Thailand, Timor-Leste, and Vietnam, and also observers from JICA headquarters and JICA country office, and also ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. It is my pleasure to welcome all delegates on behalf of the Ministry of Health to the Knowledge Sharing Program. I would like to appreciate JICA for your continued support concerning the development, implementation, and improvement of MCH services, particularly through the MCH Handbook. I would also like to express my gratitude to the Ministry of State Secretariat and the Ministry of Foreign Affairs for the fruitful collaboration with the Ministry of Health and JICA in organizing this event. Since 2007, Indonesia has conducted the third country training program involved of 15 participant countries member of the Organization of Islamic Cooperation, the South-South and Triangle Cooperation, and the Association of Southeast Asian Nations. This year, we proudly invite delegates from country members of this organization in virtual meeting to share their experiences and lessons learned on MCH Handbook implementation in the era of COVID-19 pandemic. Distinguished participants, the development of MCH Handbook in Indonesia has been started since 1994 by integrating separated maternal and child health services record into MCH Handbook. The book serves as home-based record for mothers and under 5 children, as well as a source of useful information for pregnant women and families, which enables the continuity of care during this critical period. In addition to its role in the maternal and child health program in Indonesia, the MCH Handbook has also contributed to the Indonesian international cooperation through the commitment and cooperation in the implementation of MCH Handbook. In 2019, Indonesia has proudly hosted a side event, Effective Implementation of Home-Based Record to Improve Maternal, Newborn, and Child Health, at the 72nd World Health Assembly in Geneva, supported by the countries of Afghanistan, France, Japan, Kenya, Laos PDR, Myanmar, the Netherlands, the Philippines, and Zimbabwe. Ladies and gentlemen, as we all aware, currently the world is facing a difficult time. Like in any other countries, in Indonesia, the number of cases of COVID-19 is still increasing. There are now more than 400,000 confirmed cases, and more than 14,000 people have lost their lives. Among those, around 2% of confirmed cases and almost 1% of death number are under 5 children. In August 2020, Indonesia conducted intra-action review for COVID-19 response, which comprehensively covered the 9 key pillars of the COVID-19 response. First, command and coordination. Second, risk communication and community empowerment. Third, surveillance, rapid response teams, and case investigation. Fourth, points of entry, international travel and transport. Fifth, laboratory. Sixth, infection control. Seventh, case management. Eighth, operational and logistic support. And ninth, maintaining essential health services and system. It also included special consideration for community transmission setting and low capacity and humanitarian setting. Distinguished delegate, COVID-19 has impacted maternal and child health services. A rapid survey conducted in June found that 75% of village health posts, or posyandu, were closed. Nearly 86% of posyandu has reported a postponement of child growth and development monitoring, 55% immunization, and 46% of vitamin A services. In October, a monitoring survey showed that MCH services have improved. The survey found that still 16% of posyandu remain closed. There were still nearly 18% of posyandu has reported a postponement of child growth monitoring, 11% of immunization, and 3% of vitamin A services. To maintain the delivery of essential health care, Primary Health Center has expected to continue the provision of essential health services. Primary Health Center must immediately adapt it in the services provision during the COVID-19 pandemic to anticipate the increasing number of COVID-19 cases and at the same time to maintain the delivery of other essential health services in order to fulfill basic health needs for the community and their working area. During the pandemic, health services has modified with various adjustments such as integrated health services, utilization telecommunication technology, appointment, outreach services through mobile primary health center, and the essential health services should be maintained to reach all mothers and children through health service facility, integrated health post, education unit, and also social institution. In the health facilities, maternal and child health services should prioritize infection prevention protocol and arrange service area to reduce infection risk. The delivery of maternal and child health services related to COVID-19 should consider: first, clinical condition of mother and child, risk of transmission. Second, flow of treatment according to the clinical condition. And the third, appropriate health service facilities. Distinguished delegates, in delivering essential health services, especially for mother and children, the MCH Handbook plays a crucial role as a tool to empower family to continuously monitor and maintain maternal and child health. The use of MCH Handbook has been strengthened, particularly in community levels. This year, Indonesia has just completed the 5-yearly revision of MCH Handbook. We have disseminated the new revision, the new version, to health workers, cadres, cross-sectoral, and community, which aim to increase knowledge of balanced nutrition intake, danger sign of the mother and family through MCH Handbook, and also to increase growth and development monitoring by family using the MCH Handbook. Ladies and gentlemen, the pandemic has also affected our regular program in conducting international knowledge sharing program. This event has modified from offline meeting which include field visit, providing the opportunity to experience the implementation of MCH Handbook in Indonesia, to online meeting. In this online event, we aim to accommodate countries to share their experiences in handling the COVID-19 pandemic impacting on MCH and the implementation of MCH Handbook during the COVID-19 pandemic. During the program, participants will have opportunity to learn from Indonesia and also participating countries. Hopefully, all participants will acquire inspiration, gain knowledge to be performed in their countries. In addition, we can get inspiration and learn more from other countries' experiences to maintain and improve the quality of MCH services in Indonesia. Thank you.
Thank you, Ibu Kirana, for officially open the program. Ladies and gentlemen, before we proceed to the next session, I would like to ask all the participants to turn on your Zoom video as we are going to take virtual photo together. To all participants, please kindly turn on your Zoom video. Are we going to take the photo? Yes, I can see some of you already turned on your video. Yes. Okay, on my mark, 1, 2, and smile. And please hold your smile. 1, 2, and smile again. Okay, thank you very much, all the participants and speakers. And for Mrs. Renata, Mr. Takatoy, and Mrs. Kirana, you may leave the Zoom meeting if you have another agenda to attend. Thank you very much for your remarks. And ladies and gentlemen, now we are going to move forward to the first session, which will be a session on Introduce Indonesia Experience, MCH Policy and Country Experience in Implementing MCH Handbook in the era of COVID-19 pandemic. The session will be moderated by Ms. Dewi Amila Solika, from Ministry of National Development Planning of Indonesia. To Ms. Dewi, please, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I hope everyone could hear my voices clearly. I'm Amila. I am a Subdirectorate Head for Public Health, Ministry of National Development Planning, Indonesia. This is such a pleasure for me to chair this kinds of meeting, and this one is for Indonesia session. As we know, Indonesia health system is overstretched during the pandemic COVID-19, and health system in Indonesia is overburdened right now. And we understand that the key point question is how these essential health services, including MCH program in Indonesia, survive in this during COVID-19 pandemic. As we can see in our agenda, we have one speaker here, especially for wonderful speaker, Ibu Erna Mulati. She is Director for Family Health, Ministry of Health, Indonesia. She is going to present MCH policy and MCH handbook implementation in Indonesia during pandemic COVID-19 for 20 minutes, and we have 10 minutes for discussion. To make this discussion on forum effective, I suppose to which one wants to clarify or give the question, please drop your question into the chat room. And if you please to speak directly, please unmute yourself later on. I'm sure Ibu Erna is ready to give the best shot of her thoughts. Floor is yours, Ibu Erna.
Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. First of all, let's pray Allah, the most gracious, most merciful, for allowing us to gather here at the knowledge sharing program on Maternal and Child Handbook 2020. I am pleased to welcome all participants from Afghanistan, Cambodia, Laos, PDR, Myanmar, Kenya, Tajikistan, Thailand, Timor-Leste, Vietnam, and from Indonesia. I would also like to appreciate JICA for your continued support concerning the development, implementation, and improvement of the MCH Handbook in Indonesia. Ladies and gentlemen, starting the presentation today, I will describe Indonesia maternal and child health policy, including MCH implementation in the era of COVID-19 pandemic. Indonesia is located in Southeast Asia with the population of 268 million. In 2020, the estimated target of pregnant women is more than 5 million. Live births are more than 5 million, and underfed children more than 23 million. Health services in Indonesia are delivered through the primary health center and hospital. Currently, there are 10,062 primary health centers and 2,846 hospitals spread across 34 provinces and 500 cities and municipalities. Ladies and gentlemen, in the term of improving public health status, the Ministry of Health has established strategies to fulfill the right of health in every stage of life cycle through continuum of care services. This effort covers promotive, preventive, early detection, curative, and rehabilitation action. In terms of MCH services, health workers should provide specific health services from before pregnancy, pregnant women, infant, under 5 children, adolescent, reproductive age, and the elderly. Ladies and gentlemen, based on the 2015 population survey between census, the maternal mortality rate in Indonesia is 300 per 1,000 live birth, and in 2015, while the target for the reduction is 183 per 100,000 live birth in 2024. Based on the 2017 demographic health survey, the infant mortality rate is 24 per 1,000 live birth, and the target of EMR in 2024 is 16 per 1,000 live births. The prevalence of malnutrition in under 5 children, according to Basic Health Research 2013, was 90.6. The target in 2024 is set to be 14. The prevalence of the anemia in pregnancy women, according to Basic Health Research 2013, was 37.1%, and 2018 Basic Health Survey shows 48, almost 49%. The target in 2024 is set to be 20%. And the prevalence of modern contraceptive prevalence rate, according to the Indonesia Demographic Health Survey in 2017, was 57.2, and 2019 Susanas about 55, while the 2024 RPJMN target is 33%. Ladies and gentlemen, the continuum of maternal and child health services seen a decrease from the first antenatal care visit to the fourth antenatal care visit, there were pregnant women who did not check until the third trimester. The delivery at the health facilities increased from the result of basic health research 2013 and 2018, but was not much unequal early breastfeeding initiation. The ownership of the MCH Handbook in the new pregnant woman was decreased to 75%, whereas there was an increase in the ownership of the MCH Handbook in under 5 children by 19%. Ladies and gentlemen, this is the sequence of the home MCH Handbook used in the different level. At the community level, MCH Handbook mainly used in the mother class and the integrated health post, or we call Posyandu. Mother class is the platform for the pregnant woman mothers and under 5 mothers to learn about their own health and the children as well, with the main objective is to increase knowledge and skill on the basic MCH, referring to MCH Handbook under the guidance of the health worker, usually by the local midwife. In mother class, under 5 mother share experience and information about the child growth and development, about the immunization, about the nutrition, and the management of child common illness at home. Meanwhile, pregnant women share information on pregnancy, delivery, postpartum, and newborn care. Integrated health post is community-based activity delivering basic health services organized by trained cadre under the supervision and assistance of the local health workers. The service covers child growth and development monitoring, immunization, including the basic MCH education. All these services are recorded on the MCH Handbook. Both in the primary and referral level, MCH services, including specialist services, are encouraged to be documented on MCH Handbook. Regarding the antenatal care, labor, postpartum care, newborn care, infant care, under 5 care, immunization, nutrition, growth, and development. In addition to this, healthcare personnel benefit from the book when delivering information regarding the MCH services, so that mothers and families be able to make proper and prompt decision, as well as empowering mothers and family with the takeaway message. Ladies and gentlemen, since year 2012 and 2013 until now, central government provide the MCH Handbook for the most number of pregnant mothers. It regards to the utilization of MCH Handbook, many studies has been conducted to assess the implementation of the MCH Handbook. This graph shows the correlation between MCH Handbook and mother and child health services utilization from the research run by the National Institute of the Health Research and Development through Basic Health Research 2010, 2013, and 2018. The increase of MCH Handbook ownership has not been significant, especially about the compliance. However, further analysis of the MCH Handbook ownership shows the positive relationship with the contribution to access to MCH services at the antenatal care and the institutional delivery, complete basic immunization, and growth monitoring. For this reason, cross-program synergy is needed in encouraging the use of the MCH Handbook and the strengthening cross-sector collaboration, especially health professional organization, early childhood teacher, and cadre empowering family welfare institution. Since the last year, We have finished the revision of MCH Handbook and get many more of the professional organization commitment from 7 into 13 organizations. Now we have medical association commitment from doctors, OBGY, pediatrician, midwife, nurse, nutritionist, dentist, general practitioners, health official institution, hospitals, regional hospital, clinic and primary health care facilities, and clinical association. To maintain the health of early childhood, monitoring in growth and development certainly requires synergy across related sectors. In order to fulfill children's rights comprehensively, ministry, agency, local government, community organization, development partner together to disseminate the prevention of infection in children, monitoring the implementation of hygiene and healthy living habits, and how to monitor independent growth and development at home. Nowadays, we are living in an interconnected world in which our natural borders that separate us from the one another are becoming less significant. Our mobility and across-border movement have never been so intense. We are therefore living in the world in which it is impossible for us to live separation or isolated from one another. Facing of the digitalized era, the MOH has been developed any IT application to make easier the health personnel and access for the community, especially for the MCH Handbook digitalization and a cohort for MCH. Distinguished delegates, as of 16 November, the government of Indonesia announced more than 470,000 confirmed cases of COVID-19, 5,000 deaths, and 395,000 covered cases from all provinces in Indonesia. COVID-19 case effective all age group from infant to adult. Pandemic situation affective health services and health facilities. Based on health need assessment held in April and May 2020, there are several MCH services which interrupted in the last week assessment period, such as family planning 78%, immunization 77%, MCH 62%, PMTCT 29%, and IMCI 29%. In terms of the service delivery, we are facing decreased average visit immunization coverage and decreased health post services. The proportion of health post services interrupted in April and May in antenatal care. Institutional deliveries, immunization, growth, and development monitoring based on the data routine, the coverage is decreasing than the last year at the same time of pandemic COVID-19. The proportion of health post services interrupted in the same surveys reported around 86% suspension of the child growth and development monitoring. 55% reported a suspension of immunization services and 46% vitamin A and 46% reported suspension on antenatal care services. Ladies and gentlemen, based on the need for adaptation of health services, we modify most of MCH services. Regarding the maternal health care adaptation covers services for antenatal care, childbirth, postnatal care, family planning, and the contraception and newborn care. For the antenatal care consists of the teleappointment and registration include the COVID-19 risk, infection screening for the risk factor, and USG performed by doctor in the first trimester and third trimester. USG postponed for the pregnant woman, for the pregnant mother, learn from the MCH Handbook. Pregnant mothers and family are expected to learn from the MCH Handbook and aware the danger sign. Counseling for the pregnant mother suspected confirm the COVID-19. For the childbirth, consists of the self-isolation for at least 14 days before due date. Planned referral, delivered place selected by the risk factor and COVID-19 status. Postnatal care for the suspect or confirmed case is postponed. Mothers and family are expected to learn from the MCH Handbook and be aware of the danger sign. First PNC is performed in the health facility. Third, and then fourth, postnatal care depend on the COVID-19 situation in this area. For the family planning and the contraception covered by teleappointment, infection prevention protocol, preventative long-term contraception. For the newborn care, it depends on mother COVID-19 status and condition, early breastfeeding initiation, and rooming. Ladies and gentlemen, under 5 children health care adaptation are doing in community level, education, social institution, and health facility. In the community level, the activities consist of the outreach activity depend on the COVID-19 local situation, prioritizing COVID-19 transmission prevention, family conduct growth and development monitoring using the MCH Handbook, and the immunization, supplementation, monitoring for the high-risk children by appointment in the health facility. While in the educational or institution, so cover home-based learning, healthy schedule, new life adaptation by masks, hand washing, physical distancing, screen the time limitation, teleparenting class, and school infrastructure readiness. In the health facility, by prioritizing COVID-19 transmission prevention, PPE, triage, service arrangement, MCH essential services, and teleappointment. In the delivering essential health services, especially for mother and children, the MCH Handbook plays a crucial role as the tool to empower family to continuously monitoring and maintaining maternal and children health. In the COVID-19 pandemic, the use of MCH Handbook has been strengthening, particularly in the community level, by conducting webinars to disseminate the 2020 revised revision of MCH Handbook, the health workforce, cadre, cross-sectional, and the community, such as pregnant women, mothers with under 5 children, and their families. As the function of the MCH Handbook as home-based record, including the health information regarding MCH, so that MCH Handbook has a significant role for the mothers and children. The role of the MCH Handbook for the pregnant woman, especially for the risk factor screening in pregnancy, childbirth preparation, postnatal care, and the family planning. Whereas the MCH Handbook for the under 5 children cover feeding and nutrition, developmental stimulation, protection, such as the immunization, healthy lifestyle, and child protection, and evaluation about the growth, development, and the behavior. Ladies and gentlemen, in the pandemic situation, maternal and child health services must continue to run to fulfill the right to health of mother and children. The effort to reduce maternal, infant, and under 5 mortality must be carried out optimally even in the pandemic situation. Based on the next assessment, we are modifying maternal and child health services to maintain continuity of the health services, to reduce the risk of COVID-19 transmission, and to protect health workers. We learned that it is important to strengthen the use of technology, digitalization for the teleregistration, to implement triage, to separate the patient from the risk of the COVID-19, to use the appropriate personal protection equipment, and to modify essential MCH services. I hope this online meeting can accommodate countries to share their experience in handling the COVID-19 pandemic impact on MCH and the implementation of MCH Handbook during the COVID-19 pandemic. Participants will have opportunities to learn from Indonesia and participating countries so that can improve the quality of MCH services in our country. Thank you very much.
Thank you for sharing, Ibu Erna. This is quite nice overview related to MCH practices in Indonesia. Ibu Erna highlights several important points to harness the technology using teleregistration, teleappointment, as well as prenatal class, and also to increase the MCH handbook literacy. I think you said like that. And there are a couple of questions from the room chat. I've laid question, I'm afraid. I think there is one of the important question coming from, Nur Hayati from Indonesia. How can we maximize our MCH handbook program in our regency with a wide area? And the second question coming from Ahmad Sakir Haddad from Afghanistan. How to continue RMNCH basic services during COVID-19 pandemic? And the last one's coming from Widya. I think this is, could you please explain once more about the use of MCH handbook for another sector? I think this is not only for health sector, but across reference for all sector related to the MCH handbook. Okay. I'm sure Ibu Erna is ready to answer for those 3 questions. Over to you, Ibu Erna.
Okay. For the first question, so we can use the MCH handbook using the telecommunication, I think. Yeah, because for the wide area, so it is difficult that we go to one by one to home visit. So we can use the telecommunication. Okay. And for the Afghanistan, I think the strategy is almost the same. We can use with the teleregistration, and also we using the
virtual online platform.
Yeah. Using the
virtual
triage
platform.
also, and also we have the virtual for the education or the consultation, and I think for the antenatal until for the elderly, we almost have the same strategy to improve the accessibility for the health services. And then for the,
I think the last one,
the cross-sectoral, the MCH handbook is used also by the Ministry of Social Affairs for the for the social affair, they have a program, cash transfer program, and then using the record in the MCH handbook as the basic, they give the basic for give the money to the family.
Okay. Thank you so much, Ibu. I stated so important point from the last question. There is a need for cross-sectoral collaboration. It means that there is a need for, especially for Ministry of Social, to use it as a reference to have a policy in order to relate to the function.
And also in the education, the Ministry of Education, in the early child development institution, they use the MCH handbook to monitoring about the growth and development.
Okay, thank you so much, Ibu. This is a really clear answer from Ibu Erna. I think we have a couple of minutes to go, around 5 or 4 minutes. If everyone would speak directly to Ibu Erna to have a comment or to have a question, please unmute yourself and mention your name, affiliation, as well as the brief question. Is there anybody?
Timor-Leste.
Okay. Okay, from Madalena Gomez from Timor-Leste, if you're still with us. Okay, I'm sorry. I'm missing these things. Since from the committee, there is once more a question in the chat room. I think Ibu Erna should address these kinds of important question coming from Madalena Gomez, Timor-Leste. What is the reason really to revise the MCH handbook during the COVID-19 pandemic? I think Ibu Erna already stated on her presentation really clear, but you can already, you can also add some more point, Ibu, to elaborate the reason to revise the MCH handbook during the COVID-19 pandemic. I think for adaptation.
Thank you, Madalena, from the Timor-Leste. In Ministry of Health have planned to revise MCH handbook every 5 years to adaptation the condition and also adaptation the condition not only related with the policy but also about the adaptation with the knowledge and also the knowledge of the medical. For the we are revised the MCH handbook in 2019, not in 2020.
Okay.
Yeah, before the COVID-19 come. So in 2020 we are only to disseminate, to socialize about the MCH handbook revision.
Okay, so there is the urgency to revise the MCH handbook during this COVID-19 pandemic to adapt, to newly adapt further information. I think this is a good point from Ibu Erna. And I'm sorry, there is a last question coming from Yasmina, Tajikistan. This is addressing for the tests for COVID-19. Are there any analysis of tests for COVID-19 available to all part of the Indonesia?
No, not yet. For the analysis test for the available. Yeah. But
I think you mentioned, Ibu, in a triage, you said that there is a test for COVID-19 to select the patient who comes into the health facility.
Yeah, for the triage, the first we are using anamnesia. Then if they have risk for the COVID-19, so we can use rapid test. In rapid test, almost all in our area in Indonesia can be.
Okay.
But for the
swab test,
only in the certain area, but not all, not until in the sub-district.
Yeah, thank you so much, Ibu Erna. I think I will add some more point here. for the testing for COVID-19, I think we have all of these provinces could run this testing of COVID. But you know, the capacity itself, we still need to increase the capacity of this testing as well as the coverage of this testing itself. I think there is a couple of minutes to go to someone who wants to speak directly to Ibu Erna to have the comment or to have the question. Please unmute yourself. Okay, so the time is over. I'm sorry for that. Ibu Erna, this is a very nice overview. Thank you so much. There's a couple of take-home messages, I think, from this session. I have a note for two. The first one is we need to go beyond the usual country practices that we need to adapt and then continuously to revise our strategy to harness technology. All of the program now coming online, so the MCH handbook is also coming online. It is one thing to say that Ibu, there is such an adaptation plan in one thing. In another thing is we have how to make this operational. So I think thank you very much, Ibu, for your wonderful participation and all of this floor here. Thank you so much. And I do believe that we have to have hand in hand to increase our MCH services and we survive in a pandemic, COVID-19. Thank you so much. I over to you, Ms. Vimala. Thank you.
Thank you, Ibu Erna and Ibu Amila for delivering a very insightful session. For the participants, if you have any technical difficulties in your Zoom, such as like a blur presentation, please kindly inform us through the chat box and the committee later will work on it. And now let us move to the session of country experience in implementing of MCH handbook from Laos PDR, Kenya and Indonesia. And I will pass on the session to the moderator, Ms. Nur Akmalia from JICA Office Indonesia to lead the session. To Ibu Nur Akmalia, please Ibu, the time is yours.
Thank you, Ms. Vimala Asti. Good afternoon, everyone. Thank you for joining the first session of country presentation of Knowledge Sharing Program 2020. First of all, let me introduce myself. My name is Nur Akmalia from JICA MCH Project Indonesia. I will be responsible for hosting the session. We will listen to the presentation from 3 countries, and each country have 15 minutes to present their presentation. After all the presentation are finished, we will open a question and answer session for 15 minutes. Now, I would like to introduce our presenter. For the first one is Ms. Bulamafong Petompon from Laos PDR as the first presenter. Hello, Ms. Bulamafong. Nice to meeting you again.
Yes.
Yeah. And the second one is Ms. Lydia Wanjiru Karimurio from Kenya. Hello, Ms. Lydia.
Hello.
How are you?
Thank you. I'm
Yeah.
well, thank you. How about you?
Okay, it's nice to have you here, Ms. Lydia. And the last one for this session is Ms. Retno Mratihatani from Provincial Health Office of Central Java, Indonesia. Hello, Ibu Retno.
Hello. Good evening.
Okay, good evening, good afternoon. How are you, Ibu?
Good afternoon. Fine, thank you.
All right, so let's start for the presentation. For the first presenter, Ms. Bulamafong Petompon, are you ready?
Yes. Yes.
All right, Ms. Bulamafong, the 15 minutes is yours.
Yes, thank you. Yes. Good afternoon, everyone, and good afternoon, Ministry of Health of Indonesia, Ministry of Foreign Affairs, and JICA, and all participants. Thank you for taking the time to be here. Today, I will share about my country report. Next slide. Next slide. Yes, thank you. First, I will be talk about country basic information for the next. We talk. I talk about the data health information. No, not no. Yes. Thank you. Then information about maternal and child health. Lastly, we'll share the country experience for implementing of MCH Handbook in the COVID-19 pandemic. After that, the finished presentation, we have 5 minutes for Q&A. Yes. Thank you. Next slide. For the country basic information, the area, the first for the Lao PDR has the share border with Vietnam in the west and Thailand in the east and China in the north and the south in the Cambodia. But the area we have 236,000 and 1,800 square kilometers. Then we have key info is the mountain and plateau. The composite has 18 province and 146 districts. We have the 10,552 villages. The total population near 7.2 million. The concentrated with 49 ethnic groups in Lao PDR, but then we have the 80% has Buddhist and 5% Christian and unless believe God. For the industry, agriculture, we have hydropower, garment factory for the in Lao PDR. Next slide, please. Next. No. Next. Next slide. For the data health information, estimate population from in Lao PDR from 2015 to 2020. We have the population have quite include from 2015 6.5 million, but now 2020 we have 7.2 million population. But next slide. For the estimate, children under 5 and pregnant women in 2014 to 2019 for the estimate for the 2015 is quite includes the same, but now they have data in 2019 we have the pregnant women in 217,000 with pregnant women, but under 5 about 1,700,000 for the under 5 years. But I don't see the slide. Yes, thank you. Next slide. But 10 of ANC and SBA UNC and 5 years. I have the data. Next slide. I have the data for ANC and SBA. Yes. In the 2020, we have in this year we have the COVID situation in our country and in the world. We have the COVID-19 is pandemic. Is some data is decreased about near 5%, but this data 2020 has 9 months. No. In the ANC, 79.6% for 9 months, but SBA quite low, yes, as 51.7 for the SBA. But next slide. Next slide. Yes, thank you. For the maternal mortality rate in Lao PDR, we have the on the last time for a long time in 1919 the maternal mortality rate is quite high in Lao PDR, but now it quite decreased. In the 1997, in the L6, we have 197, but the national goal about 116 per 1,000 live birth, 1,100 live birth rate. Yes, but we have the data is degree is quite quickly because in Lao PDR we have the access the family planning increased to the women to access health facility, and the ANC is inclusive to access, and SBA inclusive, and we have the system maternal death review and response, but we have a response. We improve the emergency obstetric care, and we have the guideline for ANC, and we have the training on the province. Yes, for the response for the maternal death in Lao. Yes, next slide. But infant under 5 years mortality rate in Lao PDR, the same. It is quite high in the last time, but now is we have the 50%, 50 per 1,000 live birth. Yes, for the under 5, for the under one under years is 30% for the our national goal is quite is good for like that. Yes. Next slide. But the chain of BCG, Pentathy, Meles and Cover 2015 and 2017, we have quite increased some of the data for EP vaccination. For the UNC for 2020, the data is quite low because the some service is quite we have the COVID-19 pandemic, we have the lockdown country, but some service and some the patient, some the parent cannot to access to health facility. They are afraid for the COVID-19, but we have now they know, and the knowledge is included for the prevention for the COVID-19. That they have the service, the same service, the good service and the data is included for the 9 months for in 2020 for in Lao PDR. Yes, next slide. The same that in health facility in Laos, we have the 5 central hospital in Vientiane capital and the province 17 province hospital. We have on the most country, we have the 14 police hospital and 29 army hospital, and we have the 28 hospital Thai A and 108 hospital Thai B. But the health center we have the 1,089 health center is quite a lot, quite. But the Indonesia got a lot of health center. Yes, and on the health facility in Laos, we have the continue to service in during COVID-19 pandemic. On the most health facility is the follow by WHO guideline for the service for the mother and child health service. The same continue and the follow and the guideline and WHO is also social distancing and washing the hand and use the mask when the service in the hospital. But in Lao PDR, the data of COVID-19 is positive only 24 until now. Yes, it's not too much. Next slide. For the last, our country experience in implementing of MCH Handbook. We have experts for improve MCH Handbook on 2019. Yes, we have the train user guideline on the province, on the district hospital, and near on health center now. And we also successful to printing and useful for on health facility in 2020. But on during COVID-19 pandemic, we have a lockdown countries. But our service of mother to child, we have to continue to take care them. But some factory to printing MCH handbook, the new version is closed, and so some health facility is lacks of the new book or MCH handbook in the health facility, and we lack of about 2 or 3 months. So they don't have to use MCH handbook in the health facility. Yes. Next slide. So, this is MCH handbook user guideline. We have a contract in 2019, and we have printing and training on the health facility in Lao PDR. Yes. Next. Next slide. For the challenge of MCH handbook, for the personality for the matter, and once point, some the pregnant women don't come for the ANC, don't come health facility. The forehead, they don't have any record on their health started. When they have the pregnant women have the pregnancy, they don't go to the health facility, so they don't have to check anything for record and medicine record for them. They don't know. Started for them. The second point, the some pregnant women don't bring MCH handbook with them. When they go to health facility, it make difficult for the health provider to monitoring and to call them as an in case to referral. They don't keep the MCH handbook or pink book to keep them on when they access to health facility. It's difficult for like that. But some pregnant women cannot read. So they have they don't so they have to ask someone to read and explain her for the MCH handbook. For the new book or pink book, is a new version. We have the picture for the same Indonesia handbook. We have the picture for counseling for the take care and counseling for the danger side, for the preparedness and the how to afford the nutrition, the same family planning. We have the picture, the same Indonesia handbook. Yes. The next slide. Is for the silences for the health worker. This one point. For the we have the monitoring or assessment when we use MCH handbook. We go to assessment five province in Laos PDR last month. And we know one point the knowledge on utilization in MCH handbook of some health provider are limited, and some first point, some health workers do not use the picture or in MCH handbook on health education and do not record result for laboratory in MCH handbook. And then the third point, don't check the history or checking the detail in MCH handbook of pregnant women before examination. Last point, we don't have the assessment monitoring assessment monitoring of MCH handbook utilization. These are activity of mother and child health service in COVID-19 pandemic. We have continued to service for the mother, for the children, for unity, vaccination, for the student. We have the same continue to service in the health facility. Yes. In the is finished. Thank you for your own participation.
Yes, thank
Yes.
you. Thank you very much, Ms. Bulamavong Putompon, for your comprehensive presentation. And for all participants, I would like to remind that we're still waiting your questions. If you have any questions, please write your questions in the chat box panel. Now, we move forward to the second presenter, Ms. Lydia Karimurio from Kenya. Ms. Lydia, are you ready? Hello, Ms. Lydia.
Hello.
All right. Are you ready, Ms. Lydia?
Yes, I'm ready. Thank you.
Okay, great. Okay. Ms. Lydia Karimurio, you have 15 minutes and the screen is yours.
Thank you. I request to have the slides. So good afternoon to the people in Indonesia, the government officials of Indonesia, and also JICA, and all the panelists and participants. Thank you and welcome to this session. So I'm going to present the report for Kenya. Next slide, please. So Kenya has an appropriate, approximately population of 583, area 583 square meters. Politically, it is democratic, and it has 1 national and 47 county governments with a population of around 48 million people. This is according to the census of 2019. We have 44 tribes. Each of the 47 counties has some tourist sites, so you're welcome anytime. You could come and experience. Then the key features, we have Mount Kenya, Lake Victoria, Tana River. We also have game reserves, and we even have 1 national park, which is within Nairobi City. Economic activities, mainly agriculture, tourism. The country also benefits from flour and other produce export. And as you can see, this map is showing all the 47 counties. And also we are neighboring Sudan, Ethiopia, Somalia, Uganda, Tanzania. And at the coastal region, we have the Indian Ocean. Next slide, please. Yeah, child health status as we move towards the SDGs. As you can see this trend, this is the trend for under 5 infant and neonatal mortality, beginning from 1998, where we began with an under 5 mortality rate of 111 deaths per 1,000 live births. Infant mortality rate of 74 per 1,000 live births, and neonatal mortality of 28 deaths per 1,000 live births. And upon introduction of the MDGs and all the high impact interventions that were put in place, you can see the trend went in improving, such that by 2014, we had an under 5 mortality rate of 52 per 1,000 live births, infant mortality rate of 39 per 1,000 live births, and 22, a neonatal mortality of 22 deaths per 1,000 live births. Currently, we do not have our current data on the SDG, how we are improving, but we're using these, the UN report on 2019, we have, we are moving in reducing the deaths, and we have neonatal mortality rate of 43.2 per 1,000 live births, and infant mortality rate of 31.9, and neonatal mortality rate of 21 per 1,000 live births. Next slide, please. Yeah, maternal mortality status, again, starting from the same year, 1998, and you can see it was pretty high. That was at 790 per 100,000 live births. And we've gone reducing until by the year 2014, we were at 362 deaths per 100,000 live births. And that is the most recent that we have. And we are still continuing implementing the high impact interventions towards reduction of these mortality. They are still very high, and we're working towards reducing the same, because we have interventions like the Beyond Zero by our First Lady, and which actually states that no woman should lose life when giving life or even when giving birth. So we are working towards reduction of these mortalities. Next slide, please. And then this is the country profile on current implementation status of the MCH handbook in the national health system. And our MCH handbook is integrated in the national health system. It even has a Ministry of Health number 216. And the data that is covering all the interventions, the maternal neonatal child health interventions, is covered in the MCH handbook. They are also linked in the Kenya Health Information System, that is the DHIS2 in the Kenyan version. Then implementation is in all the 47 counties. Printing, we're doing mainly centrally at the national level with support of Ministry of Health and partners. And this is done mainly annually, once a year, and it's distributed alongside the vaccine commodities. We also have some partners who support some of the counties where they are working, and they also do some printing for those counties. We have a coordination structure that is coordinated through the Ministry of Health, the Department of Family Health, coordinating most of the activities, issues of printing, issues of capacity building, resource mobilization, and implementation. The handbook also has been revised currently. The current edition is of September 2020. We normally have a scheduled revision time within either within 3 to 5 years, or in between if we have major policy changes within in the interventions that are included in the MCH handbook. Capacity building for effective utilization is ongoing, but I would say that the coverage is still not very high, it's low. So we need to improve on this thing. Next slide, please. Next slide. Okay, thank you. Then the profile, the progress of last year action plan for participants on ITP. This is the training that was mentioned earlier during the opening session of this training. And we actually did not have participants from the country for 2018 and 2019 for the training. But in 2017, we had 5 participants who participated in the training in Indonesia. And actually the team was led by the then head of the Department of Family Health. That was quite a strong team. The implementation plan, the plan of action that they developed has been partly implemented. Currently, we are working towards finalizing the MCH handbook implementation plan, and we are remaining with a step of validation workshop to finalize the same. Next, please. Next slide. And then country maternal child health system in era of COVID-19 pandemic. So I'll start with the number of cases. Unfortunately, we did not manage to get the very current number of cases. But by 13th October 2020, we had 600, the children under 5 years of age, 655 cases and 6 deaths. Under 10 years, we had 1,277 cases and 8 deaths. The data on maternal, we did not receive by the time of this start of this training. It's a bit difficult to get the disaggregated data. We have the data of, specifying how many male, how many female, how many children, but not the total disaggregation of also the maternal data. So at start of COVID-19, there was confusion due to fear of infection among the healthcare workers and also patients and clients. Some patients on visiting the facilities were actually turned back and this led to many of them not going to seek care at the health facility. After that, we had policies and guidelines developed and disseminated to guide continuity of services, both at the health facility and community level. The guidelines on preventive measures were also developed and disseminated to all. This is to facilitate prevention at the health facility, at the community level, and also at the household level. There was also issue of stigma associated with the COVID-19, and this is still contributing to low care seeking for maternal neonatal child health and other services. Next slide, please. So this is just showing that the use of MCH handbook at both the health facility level. You can see the first one is a healthcare provider who is recording child growth measurements at the health facility using the MCH handbook. And the next one is also attending to a pregnant woman, again using the MCH handbook. During these sessions, the MCH handbook is also used to orient the mothers or the caregiver on the interventions on the MCH handbook, including even when they need to seek care for antenatal care, for delivery, for child care, postnatal care, and also to what to look out for, especially the danger signs during pregnancy, childbirth, and also postnatally for both the mother and the newborn. Next slide, please. So how are we using the country maternal child health system in the era of COVID-19 pandemic, community participation in maternal and child health services? So as you have seen, we have interventions that are being done at the health facility level, but we also have what is being done at the community level. So in Kenya, the community health structure is used for service delivery at community level with community health volunteers, whom we call CHVs, providing services at household level. The CHVs disseminate messages on prevention and care seeking, and they also assist in establishing most of the structures for prevention, especially now during the COVID-19 pandemic, where you need to have structures put in place to facilitate hand washing, keeping distance, and sanitizing, wearing of masks, so they are able to assist the communities even in public areas like markets, to help establish the relevant structures. Then the CHVs also identify suspected COVID-19 cases. They link them with their supervisors, who are community health extension workers or community health assistants, who then contact the county coordinating team for COVID-19 to provide testing and care services. The CHV also form a strong linkage between the health facility system and community for testing, home-based isolation, and the care. And for them to provide all these services, there are guidelines that were developed, and they have been trained on how to provide this care. Next, please. So the country maternal child health, again, we are looking at current barriers, challenges for providing continuity of care services under the COVID-19 pandemic situation. One of the issues is the stigma resulting to fear in seeking care at the health facility. There are also issues of protective gears, where you have inadequate supply of the PPEs, the personal protective equipment, Then there is low purchasing power for PPEs at the household level. You realize that every household member, when they are going out, where they will be interacting with the people, they are supposed to wear PPEs, I mean the mask, face mask, even when they are going to health facilities. And in some instances, they do not have the purchasing power to buy the same. The rising numbers of infections among healthcare workers is also causing worries. Like, is it last week, we within 24 hours, we lost about 4 doctors, and that was a very worrying situation. So when we look at health workers getting infected and we lose some of them, this brings a lot of fear. Then inadequate compliance to COVID-19 guidelines and protocols. I think this is not peculiar to Kenya,
Sorry,
even in
Miss
other countries,
Lydia.
we realize.
I'm sorry,
Yes?
Miss Lydia, your time is finished. So maybe you can finish your presentation soon.
Okay. Then there's overwhelming healthcare system due to increasing number of cases, inadequate testing. Next, please. Then you have increased number of COVID-19 infections, then COVID-19 deaths, and also industrial action when healthcare workers are actually demanding for better protection and allowances as they provide care to the the COVID-19 pandemic patients. Next, please. So what were we able to overcome? As regards for fear to visiting health facilities, there was sensitization on need to seek care using the MCH handbook as per the health messages that are included in the handbook. Then healthcare facility staff made arrangements to book clients to avoid overcrowding. Then the community health volunteers used the MCH handbook to advise on and mobilize mothers to seek care at health facility. And facility and community level used the MCH handbook to emphasize on adherence to COVID-19 protocols and also other resources to seek care. Next slide, please. Then what kind of support would need as a country? One is to finalize digitalization of the MCH handbook, printing and distribution of MCH handbook, capacity building for effective utilization, and periodic assessment on implementation. Next slide, please. And this is the current revised MCH handbook, edition 20 and September 2020. Next slide, please. And we say MCH handbook brings us all together to work in an integrated manner for better results. And with this, I say thank you very much for listening to me. Thank you.
All right, thank you so much, Miss Lydia from Kenya, for your great presentation. The last presenter of this session is Ms. Retno Mratihatani from Central Java, Indonesia. And as a reminder for all participants, you can still submit a question through the chat box panel during the session. All right, Ms. Retno Mratihatani, are you ready?
Yes, I'm ready.
Good, great. Ms. Retno, this precious 15 minutes is yours.
Okay, thank you, Ms. Amalia, Honorable Director General of Public Health Ministry of Health of Republic Indonesia, and the Director of Family Health of Ministry of Health of Republic Indonesia, JICA, participant, panelists, thank you. Please allow me to present about country experience in implementing of MCH Handbook Indonesia, especially in Central Java Province. Please help me to show the presentation. Next, please. Next, please. Yes, I want to talk about Central Java Province profile, geographic condition, and population. Located in the central part of Java Island, bordered by West Java Province to the west, the Indian Ocean and Yogyakarta Special Region on the south, East Java to the east, and the sea. Central Java Province located at Java in the north, covering an area about 32,548 kilometers square, or about 28.94% of the Java Islands area. The regional administration, about 29 districts, 6 municipal, and then 570 sub-districts. Urban we have 750, rural we have 7,809. A population about 34,940,078 people. Next, please. Here is country profile about maternal and child health status and SDGs in Central Java Province. Based on the book Achievement Report of Central Java Province SDGs 2019, Table 2.2 Goal 2, the objective of eliminating hunger, achievement good food and nutritional security, and promoting sustainable agriculture. It is about prevalence of anemia and pregnant women, and then percentage of infant less than 6 months who have exclusively breastfed. Then target 3.1 by 2030 reduces the maternal mortality rate to less than 70 per 1,000 live births. It is about maternal mortality rate. And then target 3.2 by 2030 ends newborn mortality. It is about under 5 mortality rate. Infant mortality rate, as we say, all marked with green mark, meaning all reached. As we know, the blue is almost reached, red need attention, but we all still trying hard, still dreaming, so that mothers and child in Central Java can live a quality life. Next, please. Here is the current implementation status of MCH Handbook in Central Java Province. In 2019, we have about 595,550 pregnant women and who have MCH Handbook, about 97.89%. And under 5 in 2019, we have 2,652,757 under 5 who have MCH Handbook, about 94.54%. The Read MCH book at home for healthy pregnant mother and toddler families who are trapped due to COVID-19 by staying connected with health workers is recommended in Central Java. And then this book brings 2 posyandu or integrated post for under 5 and then pregnant mother class and bring an under 5 mother class and survey at the health facilities. As a self-monitoring goals, as an educational tool, equipment requirement get help from social service as family hope program, or we call it Keluarga Harapan. Okay? There are regions that use of MCH Handbook as a requirement for entering elementary school and obtaining birth certificates. Some regions use MCH Handbook as annexed to maternal and infant mortality audits. And for research too, we have research about ownership, completeness of filling by hard workers, understanding of content, and so on. Next, please. About the progress of last year action plan for participant in ITP 2019 or before, the plan for completeness competition of the MCH book that will be integrated in the Healthy Children's competition was not implemented because the competition in the evaluation of healthy children in 2020 not implemented because the pandemic. And then MCH book socialization through Instagram and YouTube implemented, but not a lot of progress. And some regions have this too, like Brebes and Banyumas. And then the socialization of MCH Handbook in school, we do it only on certain occasions, not scheduled or unscheduled, not yet programmed. It is in Scout, reproductive health socialization in school. And then Promotion, monitoring, and evaluation of the use of MCH Handbook continue. Include research and evaluation of using MCH and integrated post and mother class. Read together MCH book and Surakarta. Father class, family class, reading movement one day, one MCH book sheet and Banyumas. Next, please. Here is Central Java Maternal Child Health System in era of COVID-19 pandemic. COVID-19 statistic, if any, about maternal and child cases. In Central Java Province, COVID-19 statistic came from the official website of Central Java. And in this data, have not sorted out whether the mother is pregnant or not. So periodically, we ask for reports from the district or city municipal management of the maternal health program to send the number of mothers exposed to COVID-19. And the left diagram, it is about the pregnant women who have confirmed COVID-19 based on data from the manager of maternal and child health program in the district. And the central is data on confirmed and cured pediatric cases. Next, please. Next, please. Yes. This is about health services system for COC and maternal and child health services. At the beginning of pandemic, there was a problem in maternal and child health services in Central Java. So a policy on maternal and child health services during the pandemic has been made for internal Central Java, like maternal and perinatal referral system, preparation for delivery facilities, COVID screening for pregnant mothers since August 2020. And maternal and child healthcare protocols were made by Central Java. It is about antenatal care, mother pregnant class under 5, mother pregnant class under 5 posyandu, and so on. And then monitoring tool, and the meeting cannot be had. It is about daily independent monitoring for mothers, such as fever, dizziness, fetal movement, reading MCH book, temperature, bleeding, and so on. And then monitoring guide for midwife. And then following the guidelines from the Ministry of Health, the National Disaster Management Agency from the COVID-19 Task Force. Next, please. This is about community participant in maternal and child health services. In Central Java, we have the Central Java Governor Regulation number 17, year 2016, concerning the implementation of maternal and child health. This regulates the role of all sectors in maternal and child health, including the role of community, which remain applicable for the pandemic period too. Next, please. Next, please. Yes, in Central Java, there is a Jogotongo movement, which involves all sectors of society to protect and care for neighbors, including mothers and elderly children who are included in the vulnerable group. Jogotongo Task Force, including among them family welfare development cadres, 10 guest houses, posyandu or integrated post cadres, farmers, youth organization, village assistant family help program, and so on. Next, please. So that the implementation of maternal and child health service activities during the pandemic can be carried out. As we see here, like integrated post for under 5 during pandemic, and then early detection for toddler, immunization, additional feeding, giving vitamin A, pregnant mother class, under 5 mother class, antenatal care are able to help in Central Java. Next, please. And here is some picture, the normal delivery services and contraception at primary health centers are able to help too in Central Java in pandemic time. we use delivery chamber tool and other tool. Next, please. Current barriers or challenges for providing COC of maternal and child health services under the COVID-19 pandemic situation. In some area, the condition have not improved, so that the implementation of the integrated post, the class for pregnant women, the class for mother under 5 not yet able to implement in some region. At the beginning of pandemic, hospital isolation room were full, so that pregnant women with COVID-19 had to be referred to a place that was quite far away. Even high-risk pregnant women also had difficulty in referral. Some doctors and midwives are doubtful about the status of pregnant women and toddlers who came. Health centers and hospitals have few health workers. They are work from home, and some even temporarily do not provide services. The husband of the pregnant mother came home from the red area, but did not provide any information to the midwife or doctors. Other problem is patient and family did not provide information about travel history for fear and stigma. There is a fear of people coming at health facilities too. We have time too at early of pandemic. And then at early beginning of pandemic, to availability was a problem too. It was hard to find personal protective equipment. And then other problem was financing focus on COVID. On the beginning of pandemic, activities of maternal and child health programs were stopped. Financing was focused on dealing with the pandemic. It has happened in almost all districts or municipal. Next, please. Next, please. Did your country overcome the barriers or challenges with mentioned and above and using MCH handbook? We answer yes and no. Yes, women who have normal pregnancy can monitor by reading MCH book at home, monitoring the health of children at home by MCH handbook. Still keep connecting with the health worker using monitoring tools. Keep contact by SMS, WhatsApp, video call, MCH handbook, and social media. And we answer no for barrier about referral and facilities. And referral facilities. Next, please. Did your country overcome the barrier? What support do you need to address these challenges or develop solution? One, to distribution or spread more information about the importance of MCH book to the community, the importance of reading and understanding MCH and book, the importance of monitoring the health of mother and children using
Your time
MCH.
is 50 minutes remain, 50 seconds remain.
Okay, Mrs. Amalia. Yes. And importance of filling completely MCH handbook. And then increase number of commitment of policymakers, health workers, communities, and families to use MCH book. Number 3 is reach more youth to get to know about MCH book. So we need to strengthen promotion, socialization, advocacy, and implementation too in this pandemic time through mass media and social media in accordance with the character of the community. Perhaps, next please, perhaps that's all that I can tell about MCH handbook in Central Java. Thank you.
All right, thank you, Ms. Retno, for your great and informative presentations. And now we will start the Q&A session. We have received several questions from participants, but because of the time limitation, we have selected 3 questions to read out. Here we go. The first question is from From Indonesia, Mr. Muhammad Abdullah to Ms. Bulamafong from Lau PDR. The question is, when the patient doesn't bring MCH handbook, the health provider has any difficulty in referring back the patient's history of disease. My question is the MCH handbook the only record of patient and attached when referring the patient to other health facility? And the second question, from Afghanistan to Miss Lydia from Kenya. Yeah, the question is how your country's health system provide health services to people who are in the home. Yasmina Sultan. Okay. From Afghanistan. Questions from Sultan to Miss Retno. Okay. The question is, can you tell please about the percentage of pregnant women who are with the diagnosis of COVID-19 treated at home and who are treated at hospital? Percentage of them, please. All right.
Yes, okay.
Who will answer first? Miss Bulamafong, are you ready with your answer?
Yes.
Yeah.
Yes. Thank you for your good question. I would like to answer for the question. The women treatment don't bring MCH handbook when they access in health facility. This question is for my country is very challenges in our country. For in Lao PDR, we use MCH handbooks as the main health facility for record funding. So the women don't go to any facility with the only the same book. When they don't bring or don't have the book in the hospital, but the hospital don't have the registry for the history for the pregnant woman or the patient, but some health center hospital, yes, we have our record system in for the follow up. We have the started for on this year, but only one central hospital only. We have the test started and in the one central hospital only, but all the most not yet to record. Only MCH handbook only for record the history and the medical or the other thing for the pregnant women. Yes. Are you clear for the discussion? Yes.
Okay. How about the answer? Do you clear with the answer from Ms. Bulamafong from Lau PDR? Okay, it's clear. All right. All right. We move for the question answer. Miss Lydia Karimurio, maybe you can answer the questions from Afghanistan.
Yeah, one question was, I tried answering through the chat, but one question was about involvement of the community and NGOs as regards use or implementation of the COVID-19 protocols. And the answer is that the NGOs or partners work in close collaboration with the Ministry of Health, both at national level and county level, supporting capacity building. They also support to avail some of the supplies that are required. And that collaboration has given some strength in the implementation of the protocols, so that the communities have capacity built, so that they're able to implement the protocols as they are. I don't know, the other question was about distribution. Should I answer that as well? Hello?
Is
Hello,
that clear for the... Yeah.
Yes?
Are...
There's a question on distribution of MCH handbook. And as I had indicated, we distribute alongside the vaccine commodities. And the way we do it is that when we do the national, printing, they are packaged per county, quantities per county, according to the population of expected number of pregnancies in the county for the year. They are deposited at the vaccine depot. From the vaccine depot, if there are commodities being distributed either to the counties or to the regional depots, they are delivered there. If they are delivered at the regional depot, then the counties pick from the regional depots. If they are not delivered there, then maybe they are delivered at the county. If they are not delivered at all from the national depot, then counties make arrangements to collect them. And this they do again also with the support of the partners who are working in those counties. And they arrange and they collect the copies of the MCH handbook for use at the county level. Thank you.
Ms. Lydia, for your clear explanation. And the third question from Tajikistan, Ms. Yasmina Sultanova to Ms. Ratno. Are you ready, Ibu Ratno, to answer the questions?
Yes, about percentage of pregnant women, is it?
Yeah.
Yes, the pistol about percentage of pregnant women who are with diagnosis of COVID-19. As I said before, the data of Central Java COVID-19 have not sorted out whether the mother is pregnant or not. So periodically we ask for report from the district or municipal management of the maternal health programs to send the number of mother exposed to COVID-19. Mostly pregnant women with COVID-19 isolation at home because they are healthy, and now we not yet have data about how many percent they are in house, how many percent in hospital. But when they will get delivery, we will refer them to the hospital. And sometimes information come from the referral hospital that they have COVID-19 pregnant mother, so we know that they are in hospital just like that. And until now, not yet data that how many percent in hospital and how many percent in house. Perhaps I can answer like that. Is that enough? Thank you.
All right, Ms. Ratno, thank you very much for your answer. And the time is almost over. We are sorry for the questions that we can read in this session. Thank you all for the question and answer. It was such a fruitful discussion. And as a conclusion, each country has some difficulties in providing MCH service in COVID-19. However, we could know the real situation which MCH handbook is utilized to maintain essential MCH service. MCH services such as a tool for health education and incorporation the positive use of MCH Handbook into COVID-19 protocol in community level and so on. I hope we can get some ideas to tackle challenges and adopt to each country. Finally, now we are in the end of this session. But before we end this session, I would like to remind for all panelists to submit the plan of action to Ms. Susi by the end of today's session. Thank you all presenters for your wonderful presentations, and thank you everyone for participating in the sessions. Hope you have learned and enjoyed this session. I am Nur Akmalia is signing off. Thank you very much and have a great day.
Thank you, Ibu Nur, for leading a very comprehensive sessions. Now let us proceed to the third session, country experience in implementing of MCH Handbook from Afghanistan and Tajikistan. I will hand over the session to our moderator, Ibu Diah Permata Laksmi Dewi from the Ministry of Health of Indonesia. To Ibu Diah, please Ibu, the time is yours.
Thank you, Ms. Vimala. Distinguished delegates, ladies and gentlemen, a very good afternoon, everyone. Thank you for your attendance. First of all, I'm Made Diah, as introduced by Ms. Vimala. I work for Ministry of Health, Deputy of Directorate Family Health for Under 5 Health. And now we will continue with presentations of Afghanistan and Tajikistan. We have two presenters. Let me introduce, the first one is Mr. Haddad Shakir from Afghanistan. Are you ready, Dr. Haddad?
Yes, I am.
Okay, and then the second one is Ms. Rakimova Sahlo. Yeah, Mr. Haddad is the MCH Handbook Project Manager from Ministry of Health Afghanistan, and Ms. Rakimova Sahlo is the Director Training Clinical Department of Family Medicine at Rudaki District, MOH, Tajikistan. Yeah. And we have 15 minutes for each presenter to deliver the presentation. Firstly, I would like to invite Dr. Haddad Shakir from Afghanistan to share country implementation of MCH Handbook in the era of COVID-19 pandemic. So, Dr. Haddad, the time is yours.
Thank you very much, colleagues from Ministry of Health, Indonesia, State Secretary, Ministry of Foreign Affairs, colleagues from JICA, and participants from all countries, participating countries. Assalamu alaikum wa rahmatullah. First of all, let me to extend my sincere appreciation and gratitude on behalf of Afghanistan team for generous support of Government of Japan and JICA for implementation of MCH Handbook in Afghanistan, as well as UNICEF for implementing this innovation in Afghanistan, supporting Ministry of Public Health. That's my great pleasure to be here and present the Afghanistan presentation on behalf of the Afghanistan team. Okay, next slide. So in regards with the profile of Afghanistan, as you see the map, Afghanistan is located in the Central and South Asia, bordered with Iran, Pakistan, China, Turkmenistan, Tajikistan, and Uzbekistan, and has around 647,000 square kilometers, and also Afghanistan has around 32.9 million population. Of those, 24% living in urban setting, and the rest 76% living in rural areas. The total 22% of the total population is childbearing age women, and 20% population coming under 5 years of age. Next slide, please. So, in regards with maternal and child health status, according to the SDG, we have noted 6 main indicators of health system of Afghanistan. The first one is maternal mortality ratio. Unfortunately, still we have a high maternal mortality rate in the region. According to the estimation of UN, however, the AFDHS 2015 shows the higher numbers, but after that, this figure somehow adjusted, and now we have 661 maternal mortality per 100,000 live births. And according to the SDG, Afghanistan is committed to reduce this figure to 450 till 2020, and then to 140 till 2030. In the meantime, neonatal mortality rate, according to the AFDHS 2015 Afghanistan Demographic and Health Survey, this figure is 36 per 1,000 live birth, and we are committed to reduce by 30 and 15 till 2020 and 2013 respectively. And the 5 mortality rate is 55 per 1,000 live birth, and Afghanistan is committed to SDG to reduce to 46 per 1,000 live birth, and also 27 per 1,000 live birth, respectively in 2020 and 2030. Sorry for some typo error here. This is not per 100,000. This is 1,000 per live birth. Also, according to the survey conducted in 2015, scale birth attendance is 51%, and we are committed to increase by 60% and 79% according to the SDG targets. Also, in the area of family planning, contraceptive prevalence rate is 20% currently, and our target is for 2020 and 2030 and 45 respectively. In the area of adolescent health, adolescent birth rate is 12%, and we are committed to reduce to 9.9% till 2020, and then 7.3% till 2030. Next slide, please. In regards with implementation of MCH Handbook, we also would like to extend our vote of thanks to Indonesia, because since 2015 we are a permanent member of training TCTP and also ITP programs, and this year, fortunately, to this very important technical session of MCH Handbook, and since 2017 it is piloted, and after 1 year the project was evaluated, and fortunately, based on the convincing results, the government of Japan committed to support a national scale-up, and also Ministry of Health approved the phase-wise scale-up of this very important intervention in Afghanistan. Currently, MCH Handbook is implementing in 11 provinces out of 34, and now currently we are in the phase of scale-up in more 10 provinces during November and December 2020. TOTs are planned, and next week we will be in the field for conducting TOTs, and then the trainers will be replicate the training for service providers, and actual implementation will be started and December in these 10 provinces. And the rest 13 provinces will be covered during 2021. And with that, we will be reaching to the national scale up, in which more than 3,000 health facilities distributing MCH Handbook to the pregnant women and children under 2. In these 11 provinces, as of yet, we have trained more than 5,000 healthcare providers, midwives, vaccinators, nutrition counselors, and head of health facilities. Around 10,000 community health workers oriented on MCH Handbook, and in turn, they orient communities and pregnant women on the MCH Handbook and tracking having MCH Handbook by pregnant women and children under 2. Since January 2019, more than 1.1 million MCH Handbook distributed to the target groups, which is pregnant women and children under 2. Around 80% of existing health facilities in these 11 provinces monitor and observe the distribution of MCH Handbook as a sustainable thinking, system thinking. We have included the MCH Handbook related indicators in the revised HMIS, and after scale up phase, there would be no need to collect the data vertically, and the MCH Handbook distribution data will come through routine HMIs. And also we have developed a dashboard in the DHIS2. Fortunately, it is in the trial data entry step, and soon we will share the link with all of you to see the progress of MCH Handbook implementation in Afghanistan. Next slide, please. Regarding the progress of last year action plan, fortunately, almost all action points have been done, and only the broadcasting of MCH Handbook utilization through mass media somehow partially done. And this year we will follow this activity and include in this year action plan as well. Next slide, please. So, and in regards with COVID-19, unfortunately, as part of the globe, Afghanistan also affected from COVID-19 pandemic. As of yet, we have around 41,000 confirmed cases, in which 69% were male and 31% were female. Among them, 4,500 cases hospitalized. Of those, 68% were male and the rest female. And as of yet, we have more than 1,500 dead, which case fatality rate is in Afghanistan, unfortunately, 3.7. Next slide, please. So in regards with health system in Afghanistan, for maternal and child health, all health facilities providing maternal and child health, fortunately, which is more than 3,000 health facilities, in which 2,800 health facilities providing basic emergency obstetric and newborn care services, and 150 health facilities providing a comprehensive emergency obstetric and newborn care services at the public area. Also, COVID-19 hospitals established in all provinces. In the meantime, isolation wards established for COVID-19 patients in all maternity hospitals and provincial hospitals. In the meantime, in regards with guideline development and documentation, guidelines on continuation of RMNC services, basic services during COVID-19 pandemic, adapted according to the recommendation of WHO, and we use the recent reference of WHO on continuation of services during COVID-19 pandemic. Next slide. In regards with community participation in the health services, Afghanistan has a very strong community health system in which services or basic services are providing to more than 15,000 health posts, in which there are two community health workers, one male and one female. And fortunately, with the support of UNICEF, most of community health workers oriented on prevention of COVID-19 during this pandemic. Also, in turn, they will help communities on how to take care of themselves in mild cases of COVID-19, and they help the communities on home isolation or home quarantine. Next slide. So as all participating countries mention their challenges, of course, we also face some challenges in the area of COVID-19 pandemic for implementation of MCH handbook. The most important challenge was low utilization of maternal and child health services, and in turn it affect the distribution of MCH handbook. As we analyzed the data at the same period of last year with this year, about 10% decreased utilization of services as well as distribution of MCH handbooks to the target group. Also, low community awareness on preventive measures of COVID-19. In addition, another challenge we faced in Afghanistan was shortage of personal protection equipment for healthcare providers, in which we had high mortality rate among the healthcare professionals. Next slide, please. In regards with the rest question on overcoming the barriers, yes, somehow we overcome the barriers, especially in the area of community awareness. Fortunately, with the support of UNICEF, we developed a brochure on key messages for pregnant and lactating women during COVID-19. These brochures printed and will be distributed as an annex of MCH handbook. And during distribution to the target group, one additional brochure will be distributed to them. Also, community health workers oriented on COVID-19 prevention, and these community health workers and volunteers will orient the catchment area population on how to prevent COVID-19, on how to take care of themselves while infecting with COVID-19. Next slide, please. So, in regards with the supports we need to address or overcome the mentioned challenges, we need to support health promotion interventions, especially with great focus on risk communication, because it was a gap in Afghanistan, the issue of risk communication. And recently, fortunately, a steering committee established in this area, and more support is needed to strengthen health promotion interventions at community level. Also, COVID-19 related message should be distributed along with MCH handbook to all pregnant women and children and too. It means we need some financial support and logistic support to distribute these brochures to the target groups. And also, we need to train all healthcare providers in Afghanistan in management and prevention of COVID-19. Next slide.
I am sorry, Dr. Haddad, your time remain
Yes.
2 minutes. Yeah.
Okay, yeah, that's the
2 minutes
last
remain.
slide.
Yeah.
That's last slide. Yeah,
Okay.
as we had a lot of lesson learned and success stories during implementation of MCH handbook. We would like to share the most important one, in which happened in the one of implementing provinces, which is Nangarhar. During monitoring visit of one of the district hospitals, our provincial coordinator interviewed the man having MCH handbook in a plastic bag and accomplished his wife. When he was asked who is this book belong to, he responded, it's belong to my wife. Our PC asked him to, do you know the content of this book? And have you ever learned anything about the health of mother and child from this book? He said, yes, since I'm illiterate, I learned from pictures of the book. For example, I saw in one of the pages that the pregnant woman should take care of herself and avoid heavy lifting. The statement that my wife quoted from midwife several times during her previous pregnancies, and I did not realize the issue before seeing the picture of MCH handbook. As you know that the changing attitude is very lengthy process and take time, and we are happy that with implementing MCH handbook we changed the attitude of people somehow, and now they are very happy with this intervention in Afghanistan, and everyone is receiving every target group receiving MCH handbook, and it is very accepted by the communities, also by religious leaders. Stop. Okay? Next slide. So thanks for your attention. Terima kasih.
Ya. Terima kasih juga. Thank you Afghanistan, Dr. Haddad. Thank you for your comprehensive presentation. And for all participants, if there is any questions, please write note in the chat box while we will continue the session. And the next presentation will be from Tajikistan, Dr. Rakimova Sahlo, and the time is yours. Yeah, please Dr. Sahlo. Dr. Sahlo, are you ready? Please unmute. Unmute your mic, please. Ya, Dr. Sahlo. Yeah, all of participants, if there is any question, please write note in the chat box. Yeah. Are you ready, Dr. Sahlo? Please unmute your mic. Dr. Sahlo, we cannot hear your voice. Oh, dia juga nggak bisa. Yeah. Dr. Sahlo, please look at your audio setting in your laptop. Oh, already. Yeah.
بله دکتر شهلا جان ما از افغانستان هستم. دست چپ دمی اسکرین تان ببینین در پایین مایک آن کنین. آفرین دست چپ در پایین مایکروفون است امور آن کنین. پایین دمی virtual dialogue.
Dr. Sahlo, we still
background
cannot. Yeah, we still cannot hear.
Should.
Okay, okay. While we waiting for Dr. Sahlo, yeah, we already have question from Saudat Kolova to Afghanistan. Yeah, yeah. The question is, how do you monitor the use of MCH Handbook in remote provinces of Afghanistan during a pandemic? Dr. Haddad? Dr. Haddad?
Yes.
Yeah.
Hello?
Yeah. Kindly please answer the question from Saudat Kolova. How do you monitor the use of the MCH Handbook in remote provinces of Afghanistan during a pandemic?
Yeah, thank you. Thanks for raising this very good question. Even before pandemic, we developed accelerated monitoring plan for MCH Handbook project, and fortunately, we accomplished most of the tasks included in this plan. And after that, whenever pandemic coming, we also continued the monitoring of distribution of MCH Handbook even in remote provinces, because we have one provincial coordinator in each province, and in collaboration with implementing NGOs and provincial public health offices and other stakeholders, they continued observation of distribution of MCH Handbook with respecting preventive measures during COVID-19 pandemic. And also another strategy was using the district health officers. In each district we have, in most of districts we have district health officers in which they already trained on MCH Handbook, and we send them the MCH Handbook checklist, and they collected the data and sent back to provinces, and then send feedback to us in Ministry of Public Health.
Yeah. Thank you, Dr. Haddad. I think it's a clear answer from Saudat Kolova, already answered. And then now time for Dr. Sahlo from Tajikistan.
Good afternoon. Good afternoon. Are you here?
Yeah, okay. Clear voice. Yeah, clear voice. Okay.
Yeah.
Now,
thank you very much.
Yeah, now time is yours. Yeah.
Okay.
Yeah.
Thank you very much, Miss Maid. I'm very grateful, and
Dr. Sahlo, you can call me Dia.
Yes. Dia. Oh, yes. Dia. yeah. Uh, yes. Yeah. Um, uh, I want to say. Uh, I want to say thank you very much for JICA to giving me chance to participate in the great mm, seminar, but no trading program. Next slide, please. Slide. Do you see my presentation?
Yes,
Hello.
yes, we are
Yeah.
seeing.
Yes.
Yeah, yeah,
Yeah.
yeah.
Your
Thank you
slide
very
is
much.
yeah. Okay.
Ready? Thank you. Ladies and gentlemen, let me introduce my country. Tajikistan is located in Central Asia with population of 9.2 million. The country is rich of water and green mountains, as 93% of the country consists of mountains. If you see our map, it's located in Central Asia, but we have bordering with brother country like Uzbekistan, Kyrgyzstan, China, also Afghanistan. Yes. And next slide, please. A country profile. Maternal and child health status in CDGs. Except in this program, we have a lot of vertical program also. From 2013 for developed design and contact by UNICEF. 2016 developed technical guidelines for health workers by JICA UNICEF, conduct trainings for health workers. 2016 conduct baseline study and pilot implementation in 5 districts by UNICEF. 2017 update and print in Tajik, Russian, and Uzbek languages. Current 38 districts by UNICEF, 12 USAID, 14 and BB 12 and 60% coverage. MCH Handbook, it's called in Tajik Rohnamo, provides important information about the health status of the mothers and child. Is given to every pregnant woman during the first antenatal visit and is used up child's 2 years age. Indicators of MCH and book implementation. Registration of pregnant women before 12 weeks of pregnancy is proved up to 95%. Vaccination coverage of children under 2 years is improved up to 98%. Monitoring of weight and height of children under 2 years improved up to 90%. Children under 1 year, 12 times from 1 to 2 years and 4 times. Current implementation status of the MCH Handbook in National Health System. MCH Handbook is developed in 3 languages to make it easy to read and understand for different ethnic groups. Because in our country lives international peoples like Uzbeks, Tajiks, Uzbeks, Russian, and other international people also. Work with family and community members, local councils, introduction of MCH Handbook into family medicine training programs, the courses of the Republican Family Medicine Center Clinical Center. Country profile. You know, the progress of last year's action plan for participating in ITP 2019 or before. You know, we have a lot of aim to do our action plans for 2020, but we have a lot of challenges, problems in this area because it was the reason the COVID-19. Activities. Evaluation of pilot project indicators is what 564 health facility and 12 region evaluated. Timing it was December 2019 by Republic Center Family Medicine, partners UNICEF, JICA, USAID, World Bank in Aga Khan, Project Aga Khan. The second, revisit of MCH Handbook by Ministry of Health and Social Protection Population. Its indicators, it's available of new versions of MCH Handbook until 5 years, but it's we didn't achieve this revisit by Ministry of Health because we have time for this, but it's going in the process. And Mother and Child Health Directorate and the Republican Center Family Medicine system and other system also. But here also partners, UNICEF, JICA, USAID, World Bank, and Aga Khan organizations also. The third, approval of expansions from Minister of Public Health after evaluations. It's indicators available of ministry approval. It's also in the process by Republican Center Family Medicine and Coordination Council Committee. Country maternal child health system in the era of COVID-19 pandemic. COVID-19 statistic, if any, about maternal and child case, we have total cases 11,139 and total recovered 10.3089 and total deaths it's 83. But if you have any questions, if you want to see our statistic about COVID-19, I put here our link, you can check it and you can see. Country maternal child health system in the era of COVID-19 pandemic. Of course, health service system for COC in maternal and child health service. Evaluation of the effectiveness of implementations MCH handbook after 2 years of implementation in pilot areas. Nationwide implementation of MCH handbook. Collaboration with local authorities to get their financial support. Collaboration with the Committee on Women's Affairs. Collaboration with the media. Community participant in maternal and child health service. Around table discussions in Coordination Council Committee. In Ministry of Health, signing the Memorandum of Understanding between related ministry, education, women affairs, Mufti, and it means our cultural orientations to the OB gynecologists and pediatricians and family doctor associations, involvement of partners and stakeholders, stringent community awareness through orientations for implementations of MCH handbook, advocacy through religious leader, presenting the MCH handbook in academic conference in country level. Country maternal child health system in the era of COVID-19 pandemic. Current barriers challenge for providing COC for maternal and child health service under the COVID-19 pandemic situation. Increasing mothers' awareness about mother and child health through health education in health facility and also media EAC, maternal and school and mother school. Conducting regular health, it's called in Tajik Shura, meeting in health facility level and through the health to the community members. Making the WhatsApp group for health staff of PHC and hospital, and the feedback will be sure to the health facility as well. Did your country overcome the barriers and challenges which mentioned in above by using MCH Handbook? If yes, how? If not, why? Yes, we passed the challenges by increasing the awareness and focusing on the mother and child and giving all the support needed. No. What support do you need to address these challenges? Develop solution. Our country has overcome many challenges, but we are still in need for more help from the World Organization, as we need more financial resources for trainings and implementations. Also, we need more cooperation from the media. Thank you very much.
Thank you very much. Yeah, thank you, Tajikistan, Dr. Sahlo. Thank you, all presenter for delivering interesting presentation. And yeah, and next, I would like to invite other delegates or participants to give some clarification or question or inputs about Afghanistan and Tajikistan experiences, or we can exchange some opinion or experience. You can write your question in the chat box, or you can raise your hands to directly question. Okay, now we have actually two questions. One for Afghanistan from Indonesia. The question is, how is the community empowerment in preventing COVID-19 in Afghanistan? Yeah, and then question from Afghanistan to Tajikistan. Did you evaluate pilot implementation of MCH Handbook? Yeah. Okay. I think firstly, Dr. Haddad, would you answer the question first? Yeah. Okay. Please, Dr. Haddad.
Yes. So thanks for raising the question by our Indonesian colleagues. In regards with community empowerment, as I mentioned in my presentation, we have reached to more than 10,000 community health workers in 11 provinces. In turn, they orient all pregnant women and household at their catchment area. Also, another intervention which we had for community empowerment was conducting TOT for community health supervisors. That after that they oriented CHWs and then CHWs oriented communities, and also by yes. Can you hear me?
Yes.
Yeah, and also by providing, by distributing MCH handbook to the women and children under two, especially for the pregnant women. It was also a kind of empowering communities, as we showed the example of our success story, in which male involvement was very increased in the implementation of MCH handbook. Also, we had interventions with religious leaders. As you know, Afghanistan is a religious country, and we had some intervention to convince religious leaders to advocate this MCH handbook, the community through their religious gatherings, khutbahs, Jummah prayers, and these were some main interventions in the community we have done so far.
Yeah, thank you,
Over.
Dr. Haddad. Yeah, thank you, Dr. Haddad. I think it's a clear answer that Afghanistan, through the community supervisor and religious leader, to increasing or empowering the community. Yeah, and for the next question, please, Dr. Shahlo, you can answer. Did you evaluate it? Yeah.
Thank you very much for very clear question. Yes, of course. Before implementation this MCH handbook in Tajikistan, we evaluated the between the populations. We have 12 indicators like the health service and COC for child and for mothers and antenatal care and others. It include a lot of indicators, but in 2019 we finished this the evolutions. Yes, but it's 2019, but we didn't finished it because it was pandemic and but it's in study of realizations. The result we will achieve after maybe 2 months or 3 months.
Yeah, thank you, Dr. Shahlo. Yeah, Tajikistan have 12 indicators of continuum of care MCH, yeah, to evaluate pilot of MCH handbook, and still postponed during this pandemic. Yeah, I think it's clear answer. And then, Dr. Shahlo, we have one question more from Cambodia, Mrs. Hang Ngim. Yeah, the question is, how many provinces that you did for pilot? How many? Yeah, how many provinces?
How many provinces?
That you did for pilot?
Pilot.
Yeah.
We have implementations in 38 region.
38 region, okay.
Yeah.
So now Tajikistan is implement the MCH handbook in 38 of region.
Yeah.
Okay. Thank you for the presenters from Afghanistan, Dr. Haddad, and then from Tajikistan, Dr. Shahlo. Thank you for delivering such interesting presentation. From the presentation, we can show that Afghanistan and Tajikistan have differences in status of the implementation of MCH handbook, but they still struggling to provide the MCH services and to increase or expand the MCH implementation. Yeah, I think that's our conclusion. And because the time is up, and this is finally this session is over. Thank you for all presenters for great presentation. And thank you for all participants to participate in this session. I would like to say thank you and keep up your good work in the MCH handbook implementation. Stay healthy, everyone, and thank you very much. Yeah, and I will give back the floor to Ms. Vimala. Thank you.
Thank you, Ibu Dia, for leading a very insightful and informative session. For the participants, I would like to remind you to submit your plan of actions to Ms. Susi as soon as possible. And now we are going to hear the summary of today's session, which will be delivered by Ms. Lalia Mahmuda from Ministry of Health of the Republic of Indonesia. To Ms. Lalia, please, the time is yours.
Thank you, Ms. Vimala. Distinguished participants, ladies and gentlemen, we've come to the end of the first day session. I would like to thank all of our presenters for the interesting presentation and sharing. Today, we've learned a lot of experiences from Indonesia, Laut PDR, Kenya, Afghanistan, Tajikistan, and the province of Central Java. The presenter explained their country MCH situation and strategy in overcoming the impact of COVID-19 pandemic to the maternal and child health and the implementation of the MCH handbook during this pandemic. From the presentation, there are several things that we can highlight it. In terms of MCH services during the COVID-19 pandemic, we learned that COVID-19 pandemic has a significant impact on MCH services. Access to the services have been hampered due to the increasing confirmed cases, lockdown policy, fear of stigma, and overwhelmed health system. Some countries are facing a problem of the availability of adequate PPE and adherence to the infection prevention protocol in community and health facilities. To overcome the situation, policies and guidelines have been updated to adapt the MCH services to the pandemic condition. Optimizing the use of information technology could be a solution to maintain the continuity of health services, particularly for mother and children. For the MCH handbook implementation, we have discussed that during the pandemic, the MCH handbook could play an important role as an information source for family and community to raise awareness of maternal and child health and a tool for home-based health monitoring for family. In Afghanistan, key messages for pregnant and breastfeeding mother printed as an annex of the MCH handbook to be distributed to pregnant mother and children under 2 years old. Monitoring and evaluation for MCH handbook should be conducted to understand more about the effective utilization and implementation. That's all for today. Once again, thank you for your participation. And in this occasion, let me once again remind all of country participants to submit the country plan of action for improving maternal and child health, which will be discussed in the last session of the second day program. Tomorrow, we will start an hour earlier to hear sharing experiences from Thailand, Timor-Leste, Myanmar, Vietnam, and Cambodia. Thank you very much. Thank you, Ms. Vimala.
Thank you. Thank you.
Thank you so much. Have a nice day.
Lalia. Dear participants, that is the summary of today's sessions, and now we are going to hear about the explanation of evaluation that which will be delivered by Mr. Egy Dilianda to Bapak Egy. Please, Bapak, the time is yours.
Thank you very much, Mrs. Vimala. Well, distinguished participants, my name is Egy Dilianda, and it's my honor to meet you all in this session. Well, before we call it a day, allow me to be your facilitator for evaluation sessions. I believe that throughout the day you have obtained valuable knowledge and also information. And also I observe that you have been very active throughout the day. Thank you very much for sharing your ideas and strategy and also initiative in your country. Well, please bear with me for a second before we crossing the finish line. I'm going to give you a brief overview about the evaluations. Well, I believe that all of you already aware the importance of evaluations. Evaluation is an important stage in any development interventions, projects or program that you might have been done in the past or you're about to do in the future. Well, there are at least, next. Well, there are at least 3 objectives in the context of this webinar. First, about the accountability, which means to demonstrate the work or project has been done according to the agreed standards, and also as a forms of transparency to our stakeholders and donors. Secondly, the objective is lesson learned. We would like to hear your feedbacks, comments, ideas about our programs, to check whether this program meet your expectation or not, and also achieve your objective. The third one is improvement. Based on your inputs, we are able to improve our capacity and also quality to hosting a program in the next future. So, once again, I would like to invite you to fill in the evaluation form and share your ideas, comments towards our programs. The evaluation is online. The committee already shared the link on the chat box. Please make sure check the link on chat box. Just click it and it will get you into the evaluation form. Well, to give you a little bit information about the evaluation itself, it contains 8 multiple choice questions. So you can select your answer that suits you, and also 4 open-ended questions. So you may write down your comments, idea, anything. Please be honest. Be frankly to us, so we are able to improve our capacity. So on average, it requires around 10 to 15 minutes to complete all the evaluation. So make sure. And also one thing, please make sure that you complete the evaluations in order to obtain your e-certificate after you finish or completing this webinar. Well, if you have any questions, comments, or difficulties while filling up the evaluation, please let us know through chat box or anything you can do. Well, we will have another session tomorrow about the evaluation. Well, I think that's it from me. I wish you have a fruitful discussions and also gain beneficial knowledge to your country, organization, and your community. Stay safe and healthy. Thank you very much. Have a good day.
Thank you, Bapak Egy. I hope all the participants now gain the understanding about the importance of evaluation for us actually to improve our program in the future. And I would like to inform you about tomorrow's session. Tomorrow we will start at 12 p.m. Jakarta time, GMT +7. So please adjust according your time. And also please kindly join the Zoom meeting 30 minutes before we start the session. And before we close today's session, I would like to ask you again to turn on your video, the Zoom video, because we are going to have the last photo session for today. Please kindly turn on your video, all the participants. Yes, I already see all of you, I think, here. Yes, for the one who has not turned on your video, please kindly turn on it. So yes, I think the committee is ready. In my mark, 1, 2, smile. They are screenshotting it right now. And then again, I think because we have many pages here, 1, 2, and smile again. Please hold your smile, everyone. Okay, maybe you can give like, I don't know, like a peace sign or the love sign, if you like to. Yes, the love sign or the peace sign like this. Yes, thank you. 1, 2, and smile. Thank you very much. And dear everyone, that concludes our program for today's. And we really hope that from today's program that you gain and learn new and valuable things in regarding from the implementation of MCH Handbook. And thank you once again for your active participation in each sessions, and we are looking forward to having discussion again with you tomorrow. I'm Vimala Asti is signing off. Good afternoon, have a good day, and see you again tomorrow.
See you again.
Welcome to the Public Health Center of Cipayung Subdistrict. During the COVID-19 pandemic, the Public Health Center of Cipayung Subdistrict still provides health service for children with the following procedures. First, visitors must wear a mask. Second, before entering the room, the visitors must pass through disinfectant chamber. Third, the visitors must wash their hands in 6 steps by using soap for 20 seconds with flowing water. Fourth, the visitors must maintain a 1 to 2 meter distance with the other patients. Fifth, security guards will check the visitor's temperature before approaching the registration table. Sixth, the visitors take queue number and register according to health service needed and keep maintaining a distance with the other patients. Our public health center provides 2 categories of service for children. First, service for healthy children under 5 of age, comprising immunization service and Sikumbang service to examine detection, stimulation, and early intervention. Second, service for ill children under 5 of age, comprising integrated management of childhood illness. In the service, patients are divided into 2 categories, namely URI patient and non-URI patient. The first will be directed to Children Polyclinic for cough treatment, while the latter will be proceeded to non-MCI room. To mothers who come for children immunization service, don't forget to perform precautionary measures by wearing a mask and using hand sanitizer. And also, don't forget to bring your pink book. See you and stay healthy.